is Usha Sambamoorthi, PhD. Dr. Sambamoorthi is a professor of pharmacology and associate dean for health outcomes research at the University of Texas Health Science Center at Fort Worth. She is a health economist who has dedicated her teaching, mentoring, and research efforts to improving population health by reducing disparities in gender, race, ethnicity, age, disability, and mental health. Dr. Sambamoorthi's recent research examines the topic she's going to discuss today, which is community perspectives on AI and machine learning and health equity. Her work, which has been supported by many federal agencies, overall focuses on improving population health through the examination of health access, quality, and outcomes using real-world data. Dr. Sambamoorthi, thank you for joining us.
Thank you so much, Sherry, for that kind introduction. I'm delighted to be here, and I want to focus this talk on the powerfulness of AI that already Maia Hightower highlighted. So this talk would be focusing on how can the community get involved, and what role they can play in terms of making the AI powerful, safe, and equitable, as Hightower indicated. So why this is important, as Hightower indicated, that we have an incredible number of publications and medical knowledge coming out of the AI world. And then we can also see that along with that, there is a lot of sources of bias that come across as well. And we all know that there is a doubling of medical knowledge. In 1950, it was 50 years. 1980, it is 7 years. In 2010, it is 3.5 years. In 2020, it is just 2 years, just 73 days. So by the time a medical student graduates, the medical student will only be applying 6% of their knowledge. Next slide, please. Next slide. Next, yeah. So there is a challenge ahead of us, and I want to declare that bias in AI is very complex and multifaceted. There are many approaches for mitigating this challenge, but there is no quick fix. And that is where I think there is a need for community involvement. And the community involvement happens because, as Hightower pointed out, that the human in the loop is very important. And the human in the loop can happen only with the participatory design, and then stakeholders who are diverse, and they all need to give their perspectives, because as you will know that the AI is very complex in the sense that the domain expertise comes from somebody else. And even when there is like a participation between the physicians and the computer scientists, the physicians have the domain expertise in terms of treatment and response to treatments and so forth, diagnosis and all, and the computer scientists have the domain expertise in terms of their engineering. So these two have to come together. Nobody is like, they are not experts in every field. That's why that human in the loop is very important. Next slide, please. Yeah, and as Hightower pointed out, there are so many racial biases, gender biases, and I want to give you a reference for you to take home, that there is also a geographic bias in medical AI tools. For example, only 3 states have contributed data to the many of the AI diagnostic tools, which tells you that many of the rural areas are not represented, many of these states are not represented in making decisions. Next slide, please. Next. And if you need more information about racial bias and other kinds of bias in healthcare and artificial intelligence, and NIHCM has like a data insight, which I found very helpful. And here is a source for you to learn more about it. Next. And with the advent of ChatGPT, many of you are familiar with that. It's called generative AI. And the generative AI actually amplifies the problem and adds to the problem by what is known as hallucination. It makes up things which are not there. And therefore, there is additional challenge for the communities, for everyone, to address the AI hallucination and how healthcare professionals can mitigate their risks. Next. And AI bias comes from lots of sources, but I'm going to focus on, it comes from the models, it comes from the outcomes. I'm not going to focus on the models or the outcomes. I'm just like going to give like an overview of how the community involvement and how to involve in making sure that the bias from the people are reduced and bias from the data are reduced. Next slide, please. And there are strategies out there that you can use for achieving health equity through artificial intelligence. For example, here is a paper that was looking at all the articles that were published, looking at the strategies to improve the impact of artificial intelligence on health equity. There is no surprise there. Almost 2/3 of all issue strategy pairs are related to data, as you can see from the graph over there. But then there is also a mention of engaging the broader community. As you can see, it was not in the very top list, but at least it was mentioned. And next slide, please. And next. Yeah, so this particular aspect of it, the AI and community engagement and participation and empowerment is very, very new. It's just emerging. So what do I mean by a community? By community, I mean individuals, organizations, and groups affected by or concerned with AI technologies and their impact on society. And examples are academicians, ethicists, civil rights organizations, marginalized communities, policymakers, industry experts, and advocacy groups. I think that, the community involvement is like an umbrella, and, everybody needs to be involved, because it's not going to happen by accident. It is going to happen by design, as Hightower pointed out. And here are some of the emerging community engagement and participation. We have the Artificial Intelligence Machine Learning Consortium to advance health equity and researcher diversity. I am actually one of the principal investigators of the consortium, and where our main focus is to achieve equity and researcher diversity through community involvement. And there are initiatives where they are designing AI tools for the underserved population from the ground up. One example comes to my mind, that is the purposeful AI for the minority. And there are also calls from the university researchers to develop requirements for a community engagement in AI research. And there are also local communities that are using artificial intelligence to improve health equity. Next slide, please. As it was mentioned before, we first need to listen to the community. And here is what we did. We listened to the community, and one of the top item is act local, because we all know that the problems are at a local level. They are really hyper local, and one size fits all is not going to work at all. And the other thing that stakeholders actually, when we listened to them, told us is you have to have diversity. So it's diversity, and everybody, I think the community is interested in AI/ML to become a household term. Just like, we have PCs now, we have smartphones now, we have like, all kinds of technologies in every home. So I think, the community is very interested in making this as a democratic process and democratizing the AI/ML. And the community actually realizes that there are barriers that can exist, but then they are also very, very optimistic that that can be overcome. And one of the solutions that the community is interested is in the open science platform for health equity. So it has to be very transparent. Who is making the decision? Who is at the table? How did they make the decisions? They have to be very transparent, and they have to be the open science. And community is interested in success, because we are all want to be winners, and we all are interested in the success, so that we can raise everybody to achieve the health equity. Next slide, please. So we all know that there are lots of challenges in involving AI for the community, and there are many of these things were already talked about: data bias, digital divide, lack of AI awareness education, power structure, right? They all come with the differential power structures, and historical distrust, and language and cultural barriers, lack of transparency, transparency, as well as impact and unequal benefits. All of these are challenges, but I think we can overcome these challenges. Next slide, please. So how do we overcome these challenges? We need a comprehensive approach. I call it a socio-technical approach. It has to take a collaborative and participatory approach from designing to implementing and sustaining. And it needs to involve multi and diverse stakeholders. Of course, education is also a key. And then keeping communities in the loop, which is also known as human in the loop. And then the other big thing that I want to bring to the table is interpretation of the model output. Next slide. So in terms of the participatory approach, there is so much in terms of the participatory approach. It's a very broad spectrum. It's from consulting to including to collaborating and owning the project itself. So here is where we need to figure out the participation goals, scope, form, as well as what form does the stakeholder participation take, who is involved, what is on the table, and why is participation needed. Next slide. And here is a study which actually looked at all building bridges in terms of the AI participatory approach. And I want to highlight all of them agreed that it needs to be the improving the user's experience, and a majority of them are interested in giving a feedback and also giving input on design ideas. Next slide, please. And there are lots of community initiatives that are happening. Even in AIM Ahead, we have education and AI knowledge and skills enhancing efforts. And this is one of the things I think is very necessary in terms of the building bridges between the AI and health equity and communities. Next slide, please. And there are examples here in terms of, how would we actually improve the digital divide. There are community projects that give you software and hardware, as well as, wireless capabilities in communities that are marginalized. Next slide. And data bias, diverse, this is where the diversity is very, very important. Many of the citizen science framework, and when you have lot of stakeholders who are involved, they will see problems that we are not seeing. So therefore, it is very, very important to involve the citizens. And here are some examples where they have created video data sets, and they have actually improved and reduced the bias by including lots of images from diverse population, and gender shades is an example. Next one. And here is where we are talking about the human in the loop, and we need to have a human-centered design, which is an approach to the design and development of a system or technology, so that the users have effectively and efficiently use a product. Next slide. And here is an example of keeping humans in the loop. This is a community level project which is developing a tailored contraception chatbot for Black and Hispanic young women. And you can see that where these women were involved right from the design in terms of focus group, and then they reviewed the responses, and also they also participated in the dissemination. Next one. And I think this is where the interpretability really matters a lot. It actually builds trust, it identifies bias, it improves performance. And I'm going to skip what is interpretability. Let me just give you a definition, and then I'm going to just one example from my work. Can you go up? I'm sorry, can you go down? Next slide. So whenever we are presenting the results to the community, to anyone, we need to make sure that it is interpretable. For example, here is an interpretation that came out of a machine learning model on low value or cost. And this one was looking at what is the effect of low value on cost. And then here, every point is a human being, as Hightower indicated. Every point is a human being. And then this model tells you how the model came to the decision that low value care actually increases the out-of-pocket cost for an individual. And then it also tells you how much variation there is in terms of the prediction. Yeah, you can skip the next slide, please. The same thing, you know, when you are presenting your results, again, as it was pointed out that, you know, AA has the capability to go to a very, very personal level. You need to interpret the output. You need to show them how it made the decision for each person. For example, here on the right side of the graph is an AI model that actually explains the output for each person. The point on this graph is a person. So you need to be very transparent in how the model came to this decision and how it is affecting. Is it an average effect, or there is a lot of variation in these effects? Next slide, please. And again, you can visualize it in terms of a group. What are the leading, you know, predictors in coming to a decision? And you can do it either in a group-wise fashion for the population or it's an individual fashion. For example, you can have something like this, how were the decisions made for a particular group of people. Like as Hightower said, you know, when you are stratifying by the race and ethnicity, or stratifying by sex, or stratifying by geographical region, you can tell them, you know, how these predictions came about. Next slide, please. And there are lots of tools that are available for evaluation of AI output. I have given some of these, and I think it is very, very important, even after we build the models and we are explaining all these results to the community. It's very important, the audit that Hightower talked about, you know, to ensure the scientific validity, whether it is clarity in terms of the present results, or we can reproduce the result, or it is adhering to the ethical standards. So it's very, very important for us to keep continually updating the AI output, AI models, and also the community engagement feedback is essential from the design to dissemination. Next slide, please. So again, I cannot emphasize enough that community involvement, from design to data to algorithmic training to the implementation and continuous updates, are absolutely essential to have the successful and equitable AI for community. And we have to have the participation, monitoring, and controls at every stage. Next slide, please. I think, you know, any of the work that I have presented, all the credit goes to my collaborators, and thank you so much. And it has been exciting to present this work. Any questions? And thank you.
Thank you so much, Dr. Sambamoorthi, for helping us understand the value and power of working with communities. Our final speaker